everyone. I did the reading for you again. One of the articles I want to share with you today is centered around telehealth or telemedicine. They're the same thing. Telehealth, just in case you're not sure what it is where you utilize telecommunication technologies to support long distance healthcare. And to do that, you're just basically utilizing video, phone, or email to receive healthcare. Now, one of the great things is that Philips, which is a healthcare technology company, is partnering with American Well, which is a telehealth operator. Now, one of their very first things they're doing is they're utilizing their Ugrow parenting app in order to be able to provide parents on-demand access to health care for their children. So how awesome is that? I'm so glad that they're kind of starting out with that in this program, because if you're a stay-at-home parent or a single parent, it can be really tough, especially if you have more than one kid or just a really busy schedule, to make it to the doctor's office. So I want to kind of share some of the stats and everything from this article, because it's really great and it really shows how telehealth has really evolved, and it has just devastated some of the more pessimistic expectations out there from individuals. Back in 2014, 87% of people surveyed stated that they did not expect to be utilizing or be offered any kind of telehealth services by 2017. And well, get this. By 2017, or actually in 2017, roughly 3/4 of healthcare organizations either already offered telehealth services or were planning to offer telehealth services for their customers. So, I mean, again, really big statistics there. They're just demolishing whatever negative expectations people had, and this is just really in demand. And Philips had actually already has a bunch of programs and stuff out there. By the end of 2016, they were already boasting over 70 partnerships with other healthcare organizations. They had already enacted an ICU software program where they were delivering eICU medical care, and it's an FDA-cleared eCareManager program. So again, that's a really big deal. It's cleared the FDA. It's helped a lot. The statistics that they show from that program alone states that they reduced hospitalizations by 50% and cut costs by 35%, which is amazing, because look, if healthcare organizations can cut costs and save money, then that's going to kind of be reciprocated to us, the patients or customers that are buying our healthcare, and they won't charge us as much if it's not costing them as much, hopefully. Now, another amazing thing, and doctors, listen up, is that in 2017, 20% of people surveyed stated that they would actually switch their primary care provider in order to gain access to telehealth services. So doctors, think about maybe if you're going to be offering these services in your practices too, because let's face it, healthcare is a business. So, you're going to want to look into how in demand these telehealth services are, and if you need to catch up with the times here. And let's face it, even Medicare and Medicaid are offering telehealth services and utilizing telehealth services. As of right now, 39 different states utilize telehealth services through their Medicaid programs. So that right there just goes to show that it must be cutting these costs and helping not only the cost aspect, but patient outcomes and health outcomes. Now, there are concerns, yes, about if it's really cutting costs. But I say this, as long as they keep gathering this data and they can prove and show that as a matter of fact, yes, we are having a positive effect on patient health outcomes, and compared to what this would have cost, we are saving this much money, then it's a win-win for everyone involved. So I'm going to let you go there. I hope this was helpful. If you liked this and it was helpful, give me a thumbs up. Come follow me on my channel, Kristen Talk Healthcare Edition, and stay well.